Alcohol is everywhere. In the United States, about 80% of people aged 12 and older have tried alcohol at some point. Even among children, ages 12 to 17, roughly 1 in 5 report they've used alcohol. Because drinking is so widely accepted in society, it can be challenging to recognize when alcohol use crosses the line into something more serious, like alcohol use disorder. Alcohol use disorder is a complex medical condition. While only a licensed professional can make a diagnosis, understanding the basics can help us identify when someone may need support. OD is described in the Diagnostic and Statistical Manual of Mental Disorders, and it's classified by severity: mild, moderate, or severe. Warning signs can include, but are not limited to, drinking more than intended, feeling sick from alcohol, craving a drink, drinking even when it causes depression or anxiety, continuing to drink despite harm to relationships, work, or self-care, or getting into risky situations and legal trouble tied to drinking. In short, alcohol use disorder isn't just about how often someone drinks. It's about how drinking impacts their life and health. But what counts as too much? Ethanol, the alcohol we consume, is toxic to our brain's neurons and other cells. The liver breaks it down into another toxic compound, acetaldehyde, before it's finally processed safely. Occasional drinking exposes us to these toxins, and chronic or binge drinking damages the brain much more. Standard drinks are 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits. Women have smaller blood volumes for the same body weight, which means more detrimental impacts at lower levels of alcohol intake. For women, binge drinking means 4 or more drinks in 2 hours. Heavy drinking is 8 or more drinks per week. For men, binge drinking is 5 or more in 2 hours. Heavy drinking is 15 or more drinks weekly. Alcohol use disorder is progressive, getting worse with continued drinking. But the brain is remarkable. It can recover, at least partially, when drinking stops. Early treatment gives the best chance for recovery. Relapse is common, but professional help makes a difference. If you or someone you know is struggling, remember that support and recovery are possible, and reaching out is a sign of strength, not weakness.